Overnight, I joined leaders from the International Monetary Fund, the World Trade Organization, and the World Bank Group in publishing an op-ed in many newspapers around the world that calls for a new commitment with a $50 billion rapid investment to fund the equitable distribution of vaccines and other crucial health tools. We particularly welcome that in the proposal, the majority of the new funding would be made available quickly through grants, including to fill the Act Accelerates funding gap. This would help us dramatically scale up the production of diagnostics, treatments, oxygen, medical equipment, and vaccines for equitable distribution. It should be a real game changer, and as G7 finance leaders meet in the UK this week, followed by a heads of state summit next week, there are multiple opportunities for leaders to step up. As well as securing funds to roll out health tools equitably, now is the moment for leaders to share vaccine doses with COVAX, ensure health workers and other at-risk people are protected, and extinguish variants.
Remarks. We will be sending the audio file.
In countries where vaccination coverage is better, meaning in high-income countries where the access to vaccine is better and those who have vaccinated a significant proportion of their population, the COVID situation is declining, or the number of cases and deaths is declining significantly. In some countries, it's actually nosediving. So we have the tool. That's why we said we have the public health measures at hand, which have been working in many countries, and now we have the added tool, vaccine, at hand. If we do both, we can end this pandemic quickly.
You may ask, why is the IMF concerned with vaccinations? We are deeply concerned because an increasingly two-track pandemic is causing a two-track economic recovery with negative consequences for all countries. And our data shows that in the near term, vaccinating the world is the most effective way to boost global output. In other words, vaccine policy is economic policy.
So I say also that vaccine policy is trade policy and vice versa. We won't get the vaccine production increase we need without action on trade. And without ending vaccine scarcity, we cannot get the lasting trade and economic recovery we need. We want global cooperation to save lives and pick up those trillion-dollar bills. Thank you.
My immediate priority is for countries that have sufficient supply to quickly release doses to countries that have vaccination deployment programs. The World Bank has $12 billion in vaccine financing available now and more if needed to help countries buy and distribute COVID-19 vaccines and to encourage vaccinations. By the end of June, we will have approved vaccination operations in over 50 countries.
Can help Argentina and other.
The impact, the point of impact of this pandemic shifts. And we're moving from looking at the tragedy of India and Nepal, and that point of impact shifts. And it's really been driven by the underlying incidence and the basic capacity of the health system to cope. And in the absence of high levels of vaccination, they're the two factors that are going to drive the impact of this disease in the coming months. How intense is transmission? How well is your system able to cope with that transmission? Vaccine can break that cycle, because right now, intense transmission in every country in the world has led to intense pressure on the health system and increasing case fatality rates. Vaccination can break that cycle. Continuing to implement public health and social measures can break that cycle.
It's one for the WHO official.
We know that the B1617.2, the Delta variant, does have increased transmissibility, which means it can spread easier between people. It has to do with the mutations that are identified and allowing the virus to adhere to the cell and infect the cell more easily. What I think it's important to remember is that all of these variants are combinations of mutations. So this has been reported as a hybrid, but in fact what it is it's this one mutation, the Delta variant, with an additional deletion. And so what we are really seeing is this convergence of evolution and the changes in these mutations, the changes in the virus, which is to be expected because with more than 170 million cases reported to date, which is truly an underestimate of the true number of infections worldwide, this virus will continue to change.